There are a number of things you can do to maintain good nutrition despite difficulty with chewing and swallowing. As with so many of the issues and decisions you may face, a team of healthcare professionals knowledgeable and experienced in ALS can help you manage the swallowing and weight loss symptoms of this disease. A swallowing expert, dietitian, nurse, and physician can all help you maintain good nutrition.
There are many reasons for patients to be cared for in a multidisciplinary clinic. Patients need care from multiple healthcare personnel. And I think one of the most expeditious ways and efficient ways of caring for them is for them to go to a multidisciplinary clinic so that they could see, for example, a pulmonologist or a dietitian or a speech and language pathologist.
The need for nutritional assistance are things that are often only recognized when the horse is out of the barn, when the situation has deteriorated to such a degree that we're in a crisis.
Good nutrition will give you more energy and a better sense of well-being. A well-balanced diet is essential for maintaining body muscle and fat. Without enough food, your body will break down its own muscle and fat, leading to weight loss and further muscle weakness.
Interventions to increase weight as just a doctor issue, but it's a quality of life issue. And so we try very vigorously to ensure that all our patients are getting enough hydration and enough calories.
Increasing the number of calories you eat through carbohydrates and fats will help you maintain your weight and good nutrition. Select foods such as pasta, ice cream, puddings, eggs, potatoes, cheese, cooked vegetables, soft fruits, breads, cereals, and add butter, mayonnaise, sauces, and jelly to foods. Generally, there is not a need to add extra protein to your diet. It's a good idea to choose liquids that are thick, milkshakes instead of water, cream soups instead of broths.
Thin liquids are difficult for ALS patients to swallow. We recommend a product called Thicket or something along that line. It actually is a powder that's added to any liquid and thickens it a little bit so that the patient can create the bolus and comfortably move it down the food tube and into the stomach.
For many people with ALS, there is an increased need for calories. Your diet should include adequate calories, carbohydrates, fats, proteins, vitamins, and minerals. Consult with your physician, a dietitian, or nutritionist experienced in the care of people with ALS for a specific nutritional plan to meet your individual needs and to address additional medical problems you may have. Changing the consistency of the foods you eat can make a big difference in how easily you can chew and swallow. Generally, problems with chewing and swallowing occur gradually, so small changes are effective in helping you eat and maintain nutrition.
Modify the consistency of what they eat. So rather than trying to eat lettuce and rice and peanuts and things that do have a tendency to get stuck in your throat, to try to eat softer foods. Any type of food with a gravy, for example, soft chicken or hamburger meat with a gravy is a lot more easy to swallow than a steak.
I would say that I definitely focused or concentrated more on being sure that I chewed my food really well.
Soft, moist food is less tiring to chew and will slide down your throat more easily. You may want to avoid foods that are hard to chew and swallow. Using a blender or food processor can help you enjoy the foods you like but have a hard time eating.
For patients who are having difficulty directing that food to go right down into the stomach and not get into the lungs, we would recommend a chin tuck swallowing technique where the patient takes their food serving size and tucks their chin and swallows slowly and carefully, and the food is more likely to comfortably and safely pass down to the stomach.
If you have too much saliva or it is thick, there are some tips that can help. Swallow frequently but slowly and carefully. Avoid very sweet and sour foods that can stimulate saliva production. Increase the amount of fluids you drink. If you think that milk products are thickening your saliva, try soy substitutes for dairy products. Avoid chocolate if it makes your saliva thick.
Some foods, especially dairy products, set up kind of an uncomfortable, mucusy feeling in my mouth that I don't like, although I put up with that for ice cream.
Well, of course.
It may help to eat several small meals a day rather than trying to eat 3 larger meals. If energy levels and fatigue are issues for you, select foods and beverages that are easiest to chew and swallow, and choose high-calorie foods with a lot of nutritional value, so you are getting as much as you can for the energy you are expending in eating. Taking a nap before meals and substituting a nutritional supplement for part of your meal can conserve energy.